Hello, you are tuned into Dr. Amdekar's Cheer channel, and I am Dr. Anjali Gokarn, a practicing pediatrician from a suburb of Mumbai. Friends, did you know that Beethoven, the great composer, started losing his hearing from 25 years of age and was completely deaf by the age of 45 years? Helen Keller, author, was born normal but lost both hearing and vision at the age of 19 months after a severe CNS infection. All this happened a century ago, yet, despite all our technical advances, the incidence of hearing loss has remained high. Hearing loss is the most common sensory deficit in humans today. The incidence of significant hearing loss is 0.2% in the general population, and it increases to more than 40% in NICU graduates. In adults over 50 years, 5% have hearing loss, which increases to 50% by the age of 75 years. How do we define hearing loss? The degree of hearing loss is determined by the measure of sound in decibels at which it is just barely heard. The greater the degree of hearing loss, louder the sound must be to be heard. How do we grade hearing loss? We can normally hear sounds less than 20 decibels. Depending on the level of disability, hearing loss is mild, moderate, severe, or profound. Profound hearing loss is called deafness. What are the effects of hearing loss in children? Hearing provides essential stimulation to the brain from birth, causing development of connections which help in understanding spoken language. In untreated hearing loss, these connections do not develop well. This causes a delay in speech or, in fact, no speech. It affects social interaction, behavior, and mental health. It affects the child's schooling and education. Even mild hearing loss can limit the child's development. So, early diagnosis and management of hearing loss is very important. It allows the development of brain connection and avoids the impact of hearing loss. If there is a delay in management, then these effects cannot be completely reversed and it leaves children with a permanent disability. What are the effects of hearing loss in adults? Hearing loss in adults also can be very profound. They include a loss of the ability to communicate with others, which can lead to social isolation, loneliness, frustration, and depression. It can lead to difficulties at work. It affects efficiency and earning capacity. It can also lead to loss of cognition, memory, and balance. Let us see the anatomy of hearing. As you know, sound travels from the external ear, which is made up of the pinna and external ear canal, to the middle ear, which is made up of the tympanic membrane and the three ossicles malleus, incus, and stapes. From here, it travels through the oval window to the cochlea in the inner ear. The hair cells in the inner ear then convert sound waves into electrical impulses, which are transmitted to the auditory cortex via the cochlear nerve. There are three main types of hearing loss: conductive, when the defect lies in the external or the middle ear; sensory neural, when the problem lies in the cochlea and the cochlear nerve; and mixed. What are the causes of conductive hearing loss? Factors in the external ear can cause conductive hearing loss, that is, impacted wax, growths, or infection. Factors in the middle ear, like otitis media, especially in children, tumors or growths, and otosclerosis. Any problem of the external ear and the middle ear are amenable to medical or surgical treatment, and this hearing loss is temporary and reversible. However, diseases of the cochlear or cochlear nerve cause permanent hearing loss. What are the causes of sensory neural hearing loss in children? It's genetic, syndromic or non-syndromic, intrauterine infections, the commonest being cytomegalovirus, mumps, measles, neonatal jaundice, asphyxia, head trauma, meningitis or encephalitis. It is thought that Helen Keller had meningitis, which caused her hearing and visual impairment. What are the common causes of sensory neural hearing loss in adults? Aging causes presbyocusis, which is like presbyopia due to aging. Meniere's disease, ototoxicity due to drugs like gentamicin and furosemide, and noise exposure. Noise exposure is the commonest cause of hearing loss in young adults who listen to loud music with earphones or loud music in concerts or discotheques. Autoimmune diseases can also cause sudden, unilateral, or bilateral hearing loss. Head trauma, cerebropontine angle tumors can cause hearing loss. It's thought that Beethoven had Paget's disease involving the skull bone. The overgrown skull bone pinched the auditory nerve and caused hearing loss. What are the common symptoms of hearing loss? Parents of young infants complain that the child doesn't respond to name or other sounds, or that the child responds only to loud sound, has delayed and unclear speech. Older children and adults may complain of muffling of speech. They may have trouble understanding words, especially when in a noisy place. They often ask others to speak more slowly, clearly, loudly. They need to turn up the volume of the TV or the radio and are often found sitting very close to them. They avoid socializing. They also complain of ringing in the ears or tinnitus. What are the clinical clues you'll get? On history, you ask for hearing impairment in family, ask for gestation at birth, any NICU stay, hyperbilirubinemia, ventilation needed, ask for medication history. Look for clinical signs like dysmorphia, chromosomal abnormalities, microatia, preauricular tags or pits, cleft lip and cleft palates. Investigations which are needed are a hearing assessment which can be done at any age. However, it's compulsory to be done as a screening test in young children by a test called OAE or autoacoustic emission, which is a very simple bedside test. It can also be done in older children. It tests for hearing up to cochlear outer hair cells. The test results are pass or refer. Results need to be retested again with either OAE or BERA. BERA or brain stem evoked audiometry is a test which tests for responses from the brain, much like EEG after sound is introduced in the ears. The baby needs to be asleep for this test and older babies may require sedation. It is done in babies referred from the screening test, those who have come as refer, or even in older children who do not cooperate for behavioral audiometry and needed for all NICU graduates. Behavioral audiometry test is done for children above 6 months of age. Adults can undergo the pure tone audiometry test. Besides hearing assessment in infants, when indicated, we can also do their CBCs, thyroid tests, tests for CMV infections, ophthalmology tests, and where indicated, take a genetic opinion and do genetic tests. How do we manage hearing loss? External and middle ear issues are amenable to complete correction if treated in time, and most hearing loss is completely reversible. With sensory neural hearing loss, the important thing for children is to detect early and to act swiftly. It is important to follow the 1-3-6 rule, that is, detect by 1 month, confirm by 3 months, and fit a hearing aid by 6 months. Cochlear implant surgery is best done before 2 years of age, as this has the best outcomes for hearing and cognition. Many centers now all over our country perform this very skilled and important surgery. Older children and adults with hearing impairment will need hearing aids fitted by a professional audiologist. Along with all this, the child or the adult will need speech therapy, they need to learn sign language, lip reading. We have all heard prevention is better than cure. So, what are the preventive measures? Immunize for measles and mumps, improve maternal and child health practices like hand washing, which will prevent CMV, avoid ototoxic medicines, go for genetic counseling in genetic hearing loss. Important for recreational sound users, follow the 60-60 rule. Here at 60% of maximum volume of the gadget and for less than 60 minutes and take a break. Avoid places playing very loud music. Use headphones at work to cancel out loud sounds. In conclusion, hearing impairment is a common disability. Hearing impairment affects children and adults. Universal hearing assessment should be done for all newborns within a month of birth. Identification is possible at all ages. Even adults need to be tested when impairment is suspected. Treatment is with hearing aids, cochlear implants, speech therapy, sign language, and lip reading. And like I said before, prevention is better than cure. Keep listening to the Steer channel for more such important videos.